Time now for this week's Health Matters. PA Lynn Szabo at the microphone, and I guess we're talking about natural immunity. Is this specifically with COVID or just in general natural immunity?
Well, in the beginning, it's in general because it merits some definition of terms. But yeah, it's related to COVID and vaccination. And why you should get vaccinated. So, to begin with, active natural immunity occurs through contact with a disease-causing agent, and this contact is usually not deliberate, but sometimes can be. Mm-hmm. In this case, it would be an unvaccinated person getting COVID and then recovering. Okay. So artificial or acquired immunity, it kind of goes by both, is caused by deliberate exposure to a vaccine or maybe monoclonal antibodies. Okay. Remember, monoclonal antibodies are where you get lab-created antibodies used as a treatment or a preventative for COVID. It can go both ways. So passive immunity, I think monoclonal antibodies would fit in here too, but passive immunity specifically happens during pregnancy or nursing, and it doesn't last long. Okay.
And that's just the kind of immunities and sort of a immune system that a newborn is born with?
Yeah, it's what a newborn gets from its mom. Okay. And it doesn't really last very long. So the problem with coronaviruses is they've long been recognized as changeable. Mm-hmm. So the structure changes, and that's why, and since some cold viruses are coronaviruses, that's why we repeatedly get colds.
Yeah, and why it's so hard to come up with any sort of vaccine
against just regular colds. So, and you can see that too with COVID if you're thinking variants of concern. Okay.
Right, because that just happens over time with stresses, evolutionary stresses.
Yeah, both shift and drift. Mm-hmm. So small changes over time, or sometimes a big change over time. So, so the virus is really, really good at getting around and establish immune response. That's why different species get coronaviruses.
Okay.
And that's why we are having a problem with getting coronaviruses again and again. So is it possible to establish long-lasting natural immunity to COVID? Probably not. Mm-hmm. Okay, so that's why herd immunity is so elusive.
It's just because the virus over time is going to change enough that down the road your immune system is looking at functionally an entirely new virus.
Right.
Wow, okay.
Exactly. So...
crafty coronaviruses.
I know, curse them. And because immunity lasts only for a limited amount of time with coronaviruses, I don't think they know why this is so. But study shows specifically with COVID about 10 months to 2 years. Now, why would it be max 2 years? Because we've only lived with it.
Yeah, I was going to ask, well, how the heck?
Yeah, we're still kind of looking at that. That could go out for longer.
Do you know, is there any sort of genetic base for the ability to move silently in a room? Because Mike Thornton just did that, walking in and, sitting down at the microphone.
I was impressed.
Mike Thornton sitting down with us with this week's Health Matters. The topic is natural immunity, the ins and outs of natural immunity.
Really something that seems to be being recognized more as time goes on.
This may be a thing, but maybe not.
Uh-oh.
So remember, when we're talking about SARS-CoV-2, we're really talking about the wild type, which is, I think, alpha, and then there's a beta. Remember, there's a delta. Mm-hmm. There's all stuff in between here, too, and now Omicron. I can hardly wait till we get to Z.
That'd be nice. Let's finish that up.
Anyway, immunity to the what?
You're mixing your alphabets.
I have.
That doesn't mean we're going to go through the Roman alphabet and the Greek.
Oh, man.
Right.
And then the Cyrillic.
So before we got to Omicron, this is a little, we have like alpha, beta, delta, right. So was there a gamma, epsilon in there that just didn't bubble up?
There was a gamma, and I think they skipped epsilon because of some PC concern.
Really?
Yeah.
Okay.
I didn't understand it.
Okay. Can't even imagine what that is.
Repeat it, really.
Alrighty.
I thought I heard that there was supposedly one called like Z that they skipped because that's very similar to the name of the chairman of the Chinese.
Oh, right. Okay.
And because there was so much about, the China virus and all of that, they actually skipped over that letter to label one of the variants of
Winnie the Pooh.
right, yeah.
Okay, interesting. I was just curious about that. So
Yeah. So immunity to the wild type. So if an individual was one of the people that got it originally, and remember a lot of people in like December 2019, January through March 2020 were certain they had it.
Sure.
Because they quote unquote had an illness the doctors didn't know what it was. We knew what it was. It was influenza. Just because you weren't handed antibiotics doesn't mean we were perplexed at all.
okay, yeah, right.
So I actually at that time I was doing antibodies because it was our first foothold, actually the first tool we had to try and understand this. So I was ordering antibody tests on hundreds of people in Humboldt County. I found one that was positive.
Okay, just
and
one.
out of about 500 people who were certain they had it.
Sure. Wow.
So that one person had gone to Mardi Gras. Remember Mardi Gras that year? 2020 was thought to be a super
No, it's a blur.
If you can't remember it,
All I have are these beads. I have no idea.
but it was a super spreader event and probably early on. So immunity to the initial wild type doesn't protect against variants of concern like Delta or Omicron. So
Well, yeah, that makes sense.
So it's kind of like a new disease.
Interesting. Even though the vaccines can be effective against most of the VOCs, the active immunity isn't.
Yeah, the natural immunity doesn't seem to be as protective.
Is your body's natural immunity just that much more specific than how a vaccine is engineered?
Yeah.
Okay.
Yeah. Yeah, I think vaccines are engineered intentionally to be a little more broad,
Right.
Especially with changeable virus. So many people who assume they had, this was a study actually I looked at, it was kind of interesting. It was on JAMANET, but many people who assume they had COVID without getting tested were actually wrong about 45% of the time. So, but weirdly,
That's mostly right.
yeah, you can flip a coin. Yeah, it's a coin toss.
It's barely right.
It's barely right. Okay, yeah, sure. Okay.
Right. But conversely, I thought this was interesting. 11% of people who thought they never actually had it actually had it.
Oh, wow. Okay.
So probably, subacute infections. So what's a poor Del Norder to do? If you're vaccinated, get boosted. There still seems to be kind of a surprise on this whole boosting thing. So I still want to get the word out.
Okay, so let's get the word out again.
Yeah, we talked about it last week. People who got one J&J, that's not the end of the story.
No.
You have to switch over, either get a second J&J or more, probably a better idea, cross over and get the full series of messenger RNAs. Okay? And people who got 2 messenger RNAs should probably come in and get a third if it's been about, I think it's 6 months.
Right.
That's number 2. And then for number 4, that's starting to be recognized as being needed 4 months after the third shot.
Okay.
4 or 5.
Okay.
If somebody has comorbidities, I'd probably err on the side of caution and be more like 4.
And it's so easy to get vaccinated. We were up at St. Timothy's in an entirely different state yesterday at a church that was doing a homeless outreach and vaccinations. And we were there. They had the whole Redwood Voice team. We were doing media. And Persephone was like, it's time for, actually, I'm overdue for a booster, and took 5 minutes of paperwork. And she's probably laying back there today feeling a little bit under the weather, I would assume. But yesterday was her 3rd jab.
Yeah.
Yeah, and it's super simple, and that's not even in our state. That was just going. We were over the border in Oregon, and they went, "Oh yeah, that's another form. Here you go."
Yeah, let me know if you need help with the rest of the team.
Okay, we'll check out and see what time. And conversely, too, at the same time, we've got one team member that's staying away because of Omicron sneaking around the perimeter of his household.
Yeah. Yeah, but good protection devices in place. Hold the line there, Paul. That's good. Because, the hospital's as full as it's ever been.
Oh, right now?
Yeah. That's what the nurses are telling me.
Because that's not what the numbers say on the website.
Really?
Yeah. We've had, 3 hospitalizations?
I think it said 3 as of the last update Friday.
Okay. Maybe we're talking about 2 different things. Maybe it's full of other stuff, too.
Yeah. That's not on the...
Influenza is still kind of hot. especially in Idaho, and not a lot of people here get flu shots.
Yeah.
So hard to know. So if you've been vaccinated, get boosted. But what if you've had the disease and you went to the fair in August and didn't wear your mask and you got sick?
You're on the fair board.
A really common scenario up here. So does that mean like you're done? You don't have to get vaccinated?
Yeah, you're above the law, right? That's it.
You chose a different path? No.
No.
That means it's possible you're starting to run out of immunity. And we know that people that have had the disease and get vaccinated, whether they had the disease first and vaccinated second, or whether they had a breakthrough episode of the disease after being vaccinated, that those people have super immunity, and that might actually be the key to long lasting. So does that mean you should just go to Walmart this morning without a mask and hang out arguing about who bags up cloth bags, and just get the disease? That was my experience today. I was like the only one in a group of people in line that had a mask on.
Wow.
Except for the cashier.
Wow.
Amazing.
No. Go to Walmart this morning without your mask and get vaccinated.
Yeah, it's nuts.
Oh my
So
gosh.
should you really just get it over with, because Omicron is like easier?
What's a poor Del Norder to do?
Just get it over with. That's
No, that's a roll of the dice, and you're assuming that you can get through it with no big problem. That's not very smart.
Oh, okay.
There was a 20-year-old healthy person in Humboldt County who died of COVID in the last couple of months. So no, it's not. It's not just like as easy as the sniffles for a couple of days.
I think Mike and I are. Yeah. You're so literal. As a good scientist.
I know.
We were laughing at just getting it over with, which is just this underlying suicidal message that was coming across. Not specifically the COVID. No, don't go get the COVID over with. That's not how it works, right?
Don't do it. That's a mistake. But you should, if you have had it, you should get vaccinated. Because then you get like the best of both worlds. How hard is that?
So do we know any more about super immunity as far as, whether it's an actual thing, if it's real, if it's how long it lasts?
It kind of looks like it, but nobody's come out and used those terms yet.
Yeah.
I know this may be a topic for a different Health Matters, but do you know anything about the proposed efficacy of this vaccine that the U.S. military is producing?
Yeah, it's supposed to be pretty good.
That's what I'm hearing. I'm just wondering if there's any information of when or if that might be available to the general public.
Yeah, that would be nice. But I don't, in other countries,
I could have gone on the basis that that's not an option for the poor Del Norder at this time.
Not at this time.
You could enlist.
Like, I haven't heard much about it at all. But looking at China, who made a vaccine like really early, like weeks after the initial part of the outbreak, the Sinovac, and then distributed it worldwide. We talked about this last week. There's even a Del Norder I'm aware of that was immunized with it.
Wow.
Yeah, so that was a crap vaccine, though.
Yeah.
I hear Cuba's done a pretty good one, allegedly.
I am not surprised to hear that. Cuba does medicine right. Universal health care in Cuba. Yeah, definitely. I'm not surprised to hear it. But I was thinking maybe next week, if we didn't talk about really young kids, like
we should go to Cuba
and vaccine, we should talk about what the new vaccines are kind of coming down the line.
I think
I'm volunteering to go to Cuba.
Yeah, we should do a Health Matters from Cuba, from Havana.
I think that would be.
We totally
great.
should.
We could do it on Radio Free Havana.
What's Radio Marti? Is that still a thing?
That'd be good.
Yeah.
What's Radio Marti doing now? So, no, I'm sorry. Yes, I just.
But we digress.
It's what I do. Thank you, Lynn. Oh my gosh. Okay, so did we talk about the COVID test thing?
Yeah, we did briefly. It's really easy to sign up online and get COVID tests. I'm assuming that you did it at each of your addresses here.
No.
I did.
Come on, it takes 2 seconds.
Allegedly, they're going to get here Monday.
Right.
I did it the day before the website went live because I got the inside scoop from WeVax.
Uh-huh.
Yeah, so that's been, 3 weeks.
Yeah.
And did you find it easy?
It was easy to order them. I'm still waiting for them to get here, though.
And the problem that there's only 4. But I just got an email this week saying they were going to deliver them, to my house up here on Wednesday. So I ordered them for everybody. I ordered them for my parents. I ordered them for my kids.
How do they work? What are you going to do? Is it going to be like a pregnancy test kind of thing? Is it just, is there a reagent you apply or shake it up?
Yeah, you sit there and look for a number of lines.
Okay, interesting.
Yeah,
wow.
they're not, when they're negative, that's not super reliable, but but when they're positive, there it is there.
Okay.
So false negative's really common. False positive's not as much.
Okay.
But you get 4, which is a bummer if you have, like a living situation like yours where people are coming and going all the time. And definitely more than 4 people here. Or my daughter's household, same kind of thing. Young 20-something in LA. So I'm going to send mine down to her, I think.
Yeah.
So, but I think everybody who has an address should take advantage of this and then redistribute.
Okay. All right. I'll do that.
Yeah.
I'll go.
So
Because
I could
that's
do
what
it for you. It would take 2 seconds.
I just, gotta find a link. I gotta click on the link.
Oh my God! How you suffer?
what's a poor Del Norte?
What's about? I gotta just end it all. I mean, no, that's not.
Move to
Get it over
Brookings.
with.
Move to Brookings. They might send you back.
Yeah.
Don't go to Idaho. There's too much flu in Idaho right now.
Really,
Yeah, if you
flu's
look at
going
the
on.
CDC flu map, everything was calming down. It was like low after.
It's time for the second
summer
wave,
rush.
right?
Yeah.
Yeah.
But Idaho blew up.
Oh,
in
well.
Wyoming, so not much flu shot activity there. I
Yeah.
guess.
Yeah. Well, all right. Anything else? Anything needs to get said? What can we? Anything we can do to make this all go away? Make this all stop?
Apparently not yet.
Apparently not yet. And they were talking. We were up in Curry County yesterday at St. Timothy's at a vaccine event, and somebody had talked about they were disparaging their own vaccination rates, and I just asked, what is it in Del Norte County? And she said, "Oh, it's not as bad as you guys." I'm like, oh,
the poor vaccination rate in Curry is poor, but
it's
they
not.
feel really good compared to Del Norte.
I'm glad we could give
It's
Curry
all
County
relative, I guess.
Yeah, it is. I'm glad we could do that.
I can only
for them.
imagine what it's going to be like in Shasta now that that's going to become militia country.
Well, I guess so, but that could be natural selection.
There you go. Which
I mean, really,
a militia person should be all for.
What's a poor Shastonian to do?
Head for the hills.
be in a control group.
That's great.
It's not in their long-term best interest, obviously.
Be in a control group. That's a little science jab for you right there, a little science burn. Yeah. All right, Lynn Szabo, PA, thank you so very much for this week's Health Matters, and we'll talk to you next week.
Okay.